Don. Our next speaker is Mr. Doolan, who many of you know is the CEO of the Fred Hollows Foundation and also a member of the Board of Trustees of IAPB. Brian is going to speak to us about the global cost of avoidable blindness and the economic benefits of achieving the objectives of Vision 2020.
Thank you. So I'm going to talk to you and hopefully give you some arguments and some tools for when you leave this very important conference. Because when we leave here, we leave in the knowledge that we are going back to some 86 different countries. And we need to go back to 86 different governments, 86 different ministers of health, 86 different ministers of finance. And we need to go back to them and say, we are at that tipping point. We are not trying to achieve scale. We have achieved scale in eye health. We need to now tip it over the top and achieve the very ambitious goals of Vision 2020. And just over 12 months ago, in preparing our arguments, in refining the arguments that we were putting to governments in various parts of the world, we were very fortunate in being approached by the international consulting, management, accounting firm PwC, PricewaterhouseCoopers. And they approached us in Australia and said, how could we help? We really like this idea. How could we help in achieving this incredibly ambitious, historic goal of bringing an end to avoidable blindness and achieving the rights of all people with low vision? What could we do? We said, well, let's play to your strengths. We put the question to them. We put the question to PwC. Tell us, firstly, what would it cost? And then secondly, what benefits would flow from that level of investment? That was the task that we set PwC and that we've worked with them over the last 12 to 18 months in achieving. What the PwC study, which will be available to you all, shows us is that right at the moment, too often, the costs of poor health, and including eye health, are pushed onto the poorer people in our societies. Now that won't be a shock. You all know that. But the study just underlines that for us yet again. And it says to us we absolutely have to change that paradigm. We have to show policymakers, decision makers, politicians, ministers of health, ministers of finance, people in our society who make decisions, we need to say to them, this is a good investment. And what the PricewaterhouseCoopers study has shown us, what the PwC study shows us, is that yes, we need to invest significant funds, but we are already investing significant funds. We need to make an additional investment, and that investment will have a payoff of no less, very conservatively estimated, in the developing world, the benefit will be at least 4 to 1. For every rupiah you spend, it will produce a benefit of 4 in that society. For every dollar you spend, it will produce a benefit of $4 in that developing society. And eye health, in many areas, is the low-hanging fruit. It is achievable. It is something that ministries of health can achieve. The investments are reasonable. And the benefits are significant. The reason I say we've already achieved scale, and that we need to recognise that, is that what PwC and what the study has shown us is that over the next 10 years, the world will already spend, the world is committed on the current track to spending somewhere around $5.8 trillion on eye health and the infrastructure around eye health, embedded in health systems. To achieve the goals of Vision 2020, to achieve the ratios of health practitioners, of support staff, to provide the infrastructure, to achieve the strategy that we all know so well, disease control, human resource development, infrastructure and equipment, underpinned by community education, research, advocacy. To achieve that, we need to make an additional investment of somewhere around $400 billion, just less than $400 billion. Now, that's a big figure. We're not going to get away from that. That is a significant additional investment. But we know that globally, the benefit from that, from this study, is shown to be 2.8 times globally. And in the developing world, it's over 4 times. Of the $400 billion that we need to expend to achieve the Vision 2020 goals, 2/3 of that needs to be spent in the developed world, because that's where the cost structures are highest. 1/3, or about $127 billion, needs to be spent in what is commonly referred to as the developing world. And I'm talking here about approximately 80% of the world's population. For 1/3 of that investment, we achieved gold standard Vision 2020 goals. Now, the process that we've used and process we've worked through with PwC started with a costing study, and that was published in a document called The Price of Sight. They have then developed a benefits framework and tested that. They have pulled from all the available data that have been supported by a number of NGOs, a number of non-government organisations. They have consulted with many people here and many of the health and eye health experts around the world to get best available data. And that's brought us to the point today where we can say to you, you can with confidence go back to your 86 countries and say to the Ministers of Health, to the Ministers of Finance, to the policymakers, the decision makers, expenditure on eye health gives us a return. And in the developing world, that return is no less than 4 to 1. We know if we spend $2.20 per person on eye health per capita per year over the next 10 years, we will achieve a gold standard Vision 2020 outcome, and that will have an economic benefit of just under $9 per person, over 4.1 times. Now, over and above that, that's a conservative estimate. Over and above that, there will be health benefits, there will be social benefits. Included in that is not the cost of the reduced child mortality figures and costs. We haven't factored in the flow-on effects of children having access to primary education and the economic impact that that will have as it moves through, the economic impacts of greater gender equity, the reductions on extreme poverty. We haven't even factored in the economic costs of the number of disability-adjusted life years which are averted. So it is a very conservative figure. When we go back, we say, this is at least 4 to 1. We need to support this. We need to push eye health over the top and achieve the Vision 2020 goals. There are challenges that have been thrown up in this very ambitious study. Challenges that point us in the direction of future research that needs to be done. We need to look very simply at prevalence measures, at prevalence in the various countries in which we come from. We can find very few countries where the countries actually measure the prevalence of blindness and low vision. We need to look at the economic impact on carers of people, and as we know too often, little girls who are taken out of school because they have to look after a parent, a sibling, who is vision impaired or avoidably blind. There are a range of areas that we need to look into in refining the data. But the methodology is sound. The methodology has been published in the Indian Journal of Ophthalmology that you have all received in your packs. And you can refer to that peer-reviewed methodology, and you can put that before the decision makers who say, prove it. Prove to me what you're saying. You can put before them the studies that will be available to you. What this study points us to, I think, is a couple of areas in which we need to make strategic decisions as we move forward in achieving the goals of Vision 2020. The first thing is there are a number of countries which are more than capable of meeting the economic costs of achieving the Vision 2020 goals, and there are more and more countries moving into that position. A number of middle-income countries are now in the position of being able to fund Vision 2020 standard eye health care. The greatest barrier in many countries is not economic, it's political. It's the political will to achieve what we all know is possible. That's the message we need to take back. We need to take back the message that, look, it's no longer good enough to say we can't afford eye health care, we can't afford the gold standard. That excuse is finished in most parts of the world. People say to me, well, you know, in Brazil we can't afford it. Well, in Brazil at the moment you're spending $466 per head per year on healthcare. And if you can't afford $2.20 additional expenditure for eye health, that's not a good argument. China, $118 per head at the moment. Right? I would make a plea here. We are all looking to China and India as two of the most populous nations on the earth to lead the achievement of Vision 2020. Now, there will be countries in which we need significant aid and assistance. There is no question about that. The least developed countries, the small island developing nations, countries like Myanmar, where there is, in fact, only $2 per head spent per year on healthcare, of course we need to direct our aid and development programs to countries like that. To Eritrea, where the expenditure is about $6 per head. Cambodia, about $17 per head. Even the Solomon Islands, where at the moment total expenditure is about $100 a head. That's a message for the aid and development community, and the aid and development community through donors like AusAid, like DFID, like USAID are responding. Peter will talk in a moment about some more opportunities that are becoming available through the World Bank and other donor institutions. But the basic message here that I would ask you to take away is that the barriers to achieving Vision 2020 are not economic. The study's shown us that. We are talking about a 7% increase in current expenditure globally to achieve gold standard Vision 2020 goals. The barriers are not economic, the barriers are political. It requires a political decision. And we ask all of you to go back to your 86 nations and in the context of the development of the new global plan of action, to have each of your nations respond to the zero draft of the global plan of action and to say, we're committed to this. We will make the budgetary allocation. This makes good investment sense. We will achieve the goals of Vision 2020. Thank you.